Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
Claim your life.
Picture this. You're lacing up your sneakers for a morning run. When that familiar twinge hits your knee, it's been 3 weeks since you committed to getting back into shape, and now you're facing that dreaded question. Do I push through this or call it quits? Your workout buddy texts, no pain, no gain, just power through it. But your mom's voice echoes in your head. All that running will ruin your joints. Then you open Instagram and see conflicting posts about cold plunges. One influencer swearing they're life-changing, another calling them complete nonsense. You want to stay healthy and active, but every workout feels like rolling the dice with your body. Sound familiar? Whether you're an athlete or simply trying to stay active as you age, the world of fitness and injury feels overwhelming. With so much conflicting advice, it's hard to know what's backed by science versus what's the latest trend. That's why I'm excited to have the conversation today. Your body isn't a machine destined to break down. It's incredibly adaptable when you understand how to work with it and not against it. If you are new here and you've landed on this episode, welcome. I'm Dr. Bayo, your health advocate. I'm a practicing family medicine physician in Nevada, and I bring what I see in my clinic into the work I do on the news, on social media, when I travel around the country speaking, and to this podcast. Our guest today is Dr. Jeremy Alland, a board-certified sports medicine physician at Midwest Orthopedics at Rush in Chicago. He's a team physician for the Chicago Bulls and White Sox, an assistant professor at Rush University. Dr. Allen also hosts the podcast, Hey Doc, Quick Question, where he answers real health questions with evidence and humor. Dr. Jeremy, welcome to the show.
That was an amazing intro, Bayo. I was excited for the episode, and then I realized I was the guest that had to answer those questions. I couldn't wait to see who you were bringing on to answer all that.
Well, you're all of those things and more, and I am so excited to have you on the show. So are you willing to play a game with me?
I love playing games. Let's start with an icebreaker.
Yes, let's do some rapid fire questions. Okay, because this will help everybody get to know you even better. So what did you originally want to be when you grew up?
I think like a lot of young boys, I wanted to be a professional athlete. I played every sport known to man. I think baseball was the thing that I liked the most. And so I'll be more specific and say I wanted to be a professional baseball player.
Okay. Which body part is the most prone for injury?
Ooh, I think it kind of depends on what you're doing, but I would say the thing we see in the office the most is the knee. So I'm going to say the knee. All
right. Your go-to drink at a coffee shop?
I am a huge coffee snob. So anybody listening would be like, I almost would have to say I have to pick the coffee shop before I pick the drink. But I would say in the wintertime, it's a pour over of a single origin, beautiful bean and light roast. And in the summertime, especially here in Chicago, I love a good cold brew.
Oh, I love it. Okay.
Black with both. Nothing. Don't put anything in it. Just give me the coffee.
That's me too. I'm complete like black coffee. Next time I'm in Chicago, we have to do a coffee run. It's just like we're going to put it on our agenda. I love that. All right. Coolest part of working with professional athletes?
It makes me feel like I'm still part of the team a little bit. I told you I wanted to be a professional athlete. I'm 6 foot, 180 pounds at this point in my life. I think if you were standing in this room, you would realize I was probably not going to be a professional athlete. I think it allows me to take what I'm good at on the medicine side and take what I'm good at understanding what it's like to be an athlete at a high level and put them together. And therefore, I think I'm very good at making these people feel like they're regular human beings because they are. And that can be a challenge because they are not very much treated like regular human beings.
You know, as physicians, we see each person as an individual. They're human beings. There's anatomy. There's all the things. And I love that outlook on how you shared. They are human beings, even though there's different thoughts on who they are, but you get to just see them as a doctor. And like, that is an amazing, and I don't even want to say just, you see them as a doctor, as your patient. And that is a beautiful gift because it's all about health. Okay, next question. What's the biggest myth about exercise and injury that you hear all the time?
that it'll destroy your joints.
If you could get everyone to understand just one thing about their body and movement, what would it be?
Lift weights.
What's your favorite way to stay active?
Well, my favorite way to stay active is to do something competitive. So I like playing golf and I like playing basketball. So those are probably the things I like to do the most. I don't like to do it, but I try to follow my own advice. And so I try to make sure I'm doing some lifting throughout the week.
I love it. Okay, so let's just start with the basics. What exactly is sports medicine and who should be seeing a sports medicine doctor?
I'm asked that question a lot. I don't know why this field was called sports medicine, to be honest. I'll explain what sports medicine is as a whole, and then let's also break down maybe the misnomer of sports medicine. Sports medicine is more or less a physician who is responsible for seeing you for things that keep your body moving. And most of the time that would be like orthopedic type things. Now, I call myself sometimes a non-operative orthopedist because I think that resonates with people on what I do on a daily basis. But I'm a lot more than that because I am a family physician at Baseline. So just like you, Dr. Bayo, I am a board certified family doctor. I did a fellowship in sports medicine. So I see the body as a whole. So when the patient comes in, I'm not just hearing about their knee pain and thinking about their knee pain. I have diagnosed somebody with 4-vessel coronary artery disease because they were having back pain. I have diagnosed somebody with systemic lupus because they were having symptoms but thought it was joint pain. I see gout all the time. These are things that, maybe the very busy surgical-based doctor may not be thinking about because we're a little bit too specialized in that area. Now, the term sports medicine, I think sometimes actually keeps some people from coming in because I think they're like, well, I don't play sports and I'm not a professional athlete, so I don't think that's the right doctor for me. And I also think it actually brings a lot of people in because people don't like to be sick. And if you're a sick person, then you have to see a doctor. But if you're going to a sports medicine doctor, I'm not sick. I just need a sports medicine doctor. And so in a weird way, it brings some people in and keeps some people out. And what I would try to tell you is you don't need to play sports to see me. I always define my patient population as anybody who wants to either be more active, stay active, or get active. If you want to be an active individual, you have a place in my office because I can work with you.
I love how you outline that because when you say sports medicine, yeah, a lot of people are like, oh, I have to be playing a sport to come. But no, in the end, it is, I like to call it like preventative medicine. You want to keep doing what you want to do and want to be able to do it for years to come. And that is a fantastic way to describe it. So now we got to get more people in to understand that whole body perspective. Next question. A lot of people worry about movement and that it will kind of be that wear and tear on their joints. But what's the truth behind that myth?
Yeah, exercise and movement does not destroy your joints. It does not degenerate your joints. It's the complete opposite. It's the thing that makes your joints resilient. I think most people at this point are familiar with the recommendation to women as they get older to make sure they're doing impact exercise to keep their bones strong for osteoporosis prevention. But in the same way, if you are not putting forces through your joints, then the cartilage and the structures that are in them are also not gaining resiliency. Collagen itself likes to take load and then become more resilient, just the way we like to raise our children. You have to stress it to make it resilient. And I think one of the things that has been a misconception probably since the advent of the MRI, if you want my honest opinion, maybe the MRI that was accessible for orthopedic purposes, is that excess activity leads to degeneration, when in reality, degeneration is mostly due to age and genetics. So if you find somebody who has arthritis in their knee or even like tearing of their meniscus in their knee without a specific injury, like these are natural parts actually of getting older. I compare it to jeans a lot of time. Like if you wear your favorite pair of denim jeans and you wear it every day for 5 years, in the areas where there's very high use, of course they are not going to look the same as when they were brand new. But we're also not like jeans. If you sit in the chair for 5 years and you did nothing for 5 years, you may still end up with degenerative joint disease, but you also maybe have high blood pressure, high cholesterol. You may have metabolic disease. There's a lot of other things that can happen to you because you're now sedentary. And that actually, the sedentary diseases, these chronic illnesses that I've referenced, can actually cause more joint disease. And so the fact of the matter is that destruction of joints is not due to exercise and activity. Exercise and activity is preventative for these problems.
And often that kind of a crossover for that connective piece, people don't really understand that. They're like, well, I've got to preserve so I can do things. But if you don't do anything, you're not able to actually move and have activity. It's not preservation. It's actually breaking down what you are meant to do. The joints are meant to move. You are meant to allow your heart, your lungs, everything needs to be working in this motion to be able to really live the healthiest way possible. So if someone has pain while working out, and they've been told to push through it, now that we've just said you got to get moving, what are your thoughts as far as what are some of the red flags people should watch for? And what are some of the things that you can push through, if there is a thing that you can push through?
Yeah, I think it's important to really establish here the difference between pain and structural harm, meaning just because you have pain or discomfort or you're feeling a symptom, it actually does not mean that you're damaging yourself. And I spend a lot of time with patients on this. Pain is a warning sign. It is telling you that either your body is taking on too much load, you may have experienced an injury in which you are trying to heal, but it doesn't necessarily mean that you are harming yourself. And if you are not active, so let's use the example of I'm somebody who likes to go running a lot. And as I've been doing my running, I'm starting to notice the front of my knee is hurting more. And that is frequently called a runner's knee, aptly named. And the concern is, okay, well, if I continue to run, I'm going to cause damage behind my kneecap or in the front of my knee. And there probably is, to a certain extent, a chance that over years of running through pain, meaning you had pain every time you did this, that you could cause harm. But most people won't run through pain for years. It's just not, generally speaking, something people would do, mostly because running would probably lose its joy. Like, I just don't know who would want to continue to do that. And so the pain itself can be a guide on how much load your body can take. So we can use the running analogy. Let's say you can run 5 miles and you have no pain, but if you run 7 miles, you have pain in the front of your knee. Well, that tells me that your body can run 5, but hasn't been aptly adapted to 7 yet. Mm-hmm. And so how do I get to 7 miles? Well, you can start at the 5 and then every week maybe add 10 to 20% and see if you can start to gradually increase. Maybe your body will adapt. But in addition, I find that most people who are doing endurance exercise are not doing much on the weightlifting or strength side. And you need a significant amount of strength, especially endurance strength, to be able to do these things. And so if we focus on a strength program, all of a sudden you may notice that you can run 7 miles and the front of your knee doesn't hurt. So is it a warning sign that you're causing damage? No. Is it a warning sign that maybe we need to look into how your body is working, how much strength you have, what are your biomechanics? Lots of things around the edges. And this is where sports medicine, not from an orthopedic, I need surgery standpoint comes in, but sports medicine from somebody looking at you as a whole and going through these little factors comes in.
And when we talk about really having that strength program or all the fundamentals that are useful in hopes of not getting an injury, one question I often hear from my patients is, I don't know, is it safer to be in the gym or in the field? I don't know. I'm sure you've received this question as well. What are your thoughts?
I'm not sure there's a right answer. I mean, I think I spend a lot of time with patients talking about the nuances of movement. I had heard a term called pleasurable movement rather than the word exercise being used because there's a lot of people who have a negative connotation to the word exercise for lots of different reasons. What I like about that term is that in reality, we don't know what the right form of exercise is for everybody. Like there's nothing that says if you go do this activity, you're going to live a longer and better life than if somebody else not doing that activity. The most important thing is that you're moving. And if you hate running, don't be a runner. Like you're not going to want to do it. So find stuff you love to do and double down on it. And maybe the next layer here of prevention and also making sure you're not pushing through things is understand that to do some of those activities, you may have to train to do those activities. So if I want to be a pickleball player, I can't just start playing pickleball 7 days a week and do nothing else. Like pickleball requires a lot of quick movements. It requires a lot of shoulder and arm use. It requires a lot of endurance. So I probably should be doing some sort of strength program for my shoulders and my elbow and my back, kind of with good posture. I should be doing a lower extremity program that involves doing, like lunges and squats and lateral things where I change side to side. I should probably be doing some explosive, like little jump things, because that's simulating what I'm doing on the court. And therefore, I would probably decrease my risk of injury, but also improve my performance. I find that most patients, I don't even want to call them patients, most people who come to me with a problem with an activity that they've dove headfirst into, it's mostly because they've done too much of it without thinking about how do I train to do that thing.
That common thread, whether it's the gym or in the field, is making sure that you build up that stamina in the appropriate way. Like you mentioned, the pickleball. I love that example where all the things that you do to even just hit the ball, it's lunging, it's, those jump squats, all of those things. I don't even know if jump squats actually exist. Sorry. I don't know. I combine those
I
things.
love jump squats. You can do jump squats.
Jump squats, all of the things that need to. And when you replicate the activity that you love to do and strengthen all of the elements that are part of it, that helps you avoid injury. Fantastic. I love how you broke that down.
I think we should touch on pickleball real quick,
Yes.
because I'm sure somebody on this podcast listening is thinking about pickleball. And I hear all the time, there are so many injuries in pickleball. Like, it's got to be a problem that we're having all these injuries. And I think it's a misinterpretation of what's happening here. Pickleball has been picked up by a demographic of people who are generally older and have been more sedentary at the time of picking it up. So if you have a 60-year-old start to play pickleball, which, by the way, they love doing because there's very few competitive sports that people that age have been able to do, most of the time they're not coming from a period where they were playing a competitive sport over and over and over again. And it's a very social thing. So they go out and they play, and man, is it fun. And so they want to play the next day, and they want to play the next day, and they want to play the next day. Also, that age person generally tends to be closer to retirement, so they don't have as many reasons to not play the next day. Like, if I got into pickleball today, and I play paddle tennis, but I don't play a lot of pickleball. I have 2 children, a day job, a night job. I wouldn't have time to play pickleball more than twice a week at most. Naturally, I'm going to be at lower risk of injury because I'm a little younger than that person. I do some training with my exercise, but also I just don't have time to play. So what we really need to be focusing on is, if you like playing the sport, or you can fill in the blank with any activity, and you haven't been doing much around it, you need to gradually increase the amount you're playing. I always recommend a rest day in between to start. Let your body recover. It's a very easy way of measuring it. And then at the same time, I would start to add some training on those off days that simulates what you're trying to do. So pickleball, we already talked about a bunch of activities, but if you're trying to, go and do a bunch of stairs, then I'd be doing more lunges and squats. You just kind of simulate what you're doing and try to get stronger that way.
The top injury that I have seen for the past 2 years has been pickleball, and Achilles rupture is the one that I've seen.
Yep.
That is the big one. And I decided to, take up a new sport. I think that is the first, for those who don't know, like the chief complaint, the history of present illness. I decided to take up a new sport, and this happened. So these are wonderful gems for people who are maybe already started this new sport, thinking about starting a new sport. You now have your playbook of what you should do before, during, and while you continue to enjoy that sport. Here's a reality check. According to recent studies, sedentary behavior is linked to increased risk of chronic diseases. Yet many people avoid exercise because they're afraid of getting hurt. The irony is that staying inactive is often riskier than the potential of exercise-related injury, especially when you know how to move safely. Dr. Jeremy, can you walk us through the basics of injury prevention and how we should think about recovery, especially for people who aren't professional athletes?
Yeah, recovery is a very common term that's thrown around, but I think is very poorly defined. To a certain extent, I think it's a word that's been dominated by the wellness industry, like taken over a little bit, almost more marketing. Like, how do I sell recovery versus what truly is recovery? And I would argue actually that there's not even really a good way to measure recovery, and therefore it makes it difficult to talk about in any form or fashion. So when I talk to people about recovery, I more tell them that when you use your muscles on a daily basis, so we can use any of the activities we just said. Let's use the pickleball again, because we're stuck on pickleball, and I'm sure that 80% of your listeners are into pickleball in some form or fashion, just because that seems to be the world these days. When you play pickleball, you use a lot of your muscles. You lose your arm, as we mentioned. You use your legs as you're making all those moves. And when you do that, you break down those muscles. And that's normal. It's completely normal to break them down. And the next day, they're going to start building back up. And that's actually what makes you stronger and makes you a better player. But if you go back and play before they've had a full chance to get back to their 100% capacity, well, they're starting from a lower amount, and therefore you run the risk that you're going to drain them faster. And we know the one thing that leads to that common thread between almost every injury is fatigue. That very rarely would you find somebody who gets an injury that is not a freak traumatic incident where somebody like ran into their leg and they didn't know it was coming, where they didn't have some component of fatigue. So the analogy, or I use a ton of analogies, but the analogy I like to think about is like the cell phone battery in the upper right-hand corner of everybody's cell phone. And people will use percentages or numbers or whatever. But if you start off at 100% and then you play, and then the next day, let's say you get it down to 50% and you go to bed, you wake up the next day and now you're at 70%. And then you go play. Well, now that same 50% is now getting you down to 20%. Okay, well, now you go to bed, you wake up, you're 50%, and then you play, and now you're down to 0. And it's as that battery is drained that you are getting closer to higher risk of injury, because your muscles and tendons can't take on the load they were taking before. Your joints are more exposed to forces. And any pre-existing thing that you had, and you brought up the Achilles rupture, when you're 65 years old, the likelihood of having degeneration in your Achilles is much higher than if you're 12. If you have a pre-existing degeneration in your Achilles, which wasn't causing pain, but now your muscles and tendons and joints can't take on the load, they're fatigued. Guess what takes on the load? The degeneration, and then it ruptures. And so my thinking is this: when you do something hard on a Monday, Tuesday, if you're going to be active, and we've just encouraged you to be active, you should be doing something that is not the same exact body activity. You should be doing something that uses different muscles in a different way. And therefore, by the time you hit Wednesday, you can do the same thing you did on Monday. And there's a term for this. It's called periodization. It's been used for a long time in training circles. And I find that if you can create a sustainable schedule with periodization, alternating muscle use, and making sure that you're doing different types of activities, you've minimized your risk of injury probably the best that you can. Because active people, by the way, Dr. Bayo, they get injured. And it does happen. And you can do everything right, and you can still get injured. And I'd much rather have an active person who gets injured than a sedentary person who is afraid of getting injured.
I agree. When we talk about how exercise is good for the mind, body, and soul, it really is. And so being out there versus living in this bubble and not allowing your heart to pump, your muscles to move, all the good things that we know are important for an overall healthy lifestyle is important. So that brings me to, what are your thoughts on cortisone injections as we're talking about injuries?
I view interventions from physicians. So cortisone injection would be a part of that. So intervention meaning something I'm physically doing to you, generally speaking, as either a rescue or an aid. And the reason I say that is they rarely cure the problem. And that includes even surgery to a certain extent. I'm not talking about I broke a bone and they had to put a plate on the bone and make the bone go back together. But even some of these arthroscopic surgeries that you'll hear about, where people will get tendons kind of reattached, or maybe, meniscal type of surgeries, many times that's a situation where the pain and dysfunction has been so bad and not responded to treatment that there's no way to progress that person back to exercise without decreasing their pain level. And that's kind of how I view a cortisone injection. If you came to me and you said, I've been trying to train, my knee's killing me, I've been doing therapy actually, like with a physical therapist for 6 weeks, I pulled back on all my activity, I've been taking ibuprofen for a week, it didn't do anything, and I can't seem to get past this level with my physical therapist because my knee hurts so bad. Well, if I gave you a cortisone injection, which generally speaking is an anti-inflammatory that will decrease your pain, you may be able to get beyond that threshold at physical therapy. And my goal is to never give you another cortisone injection a day in your life. I think cortisone injections, generally speaking, get a bad rap because they've been around a long time. They are standard of practice. They don't cost a lot. They're hard to market. They're not the sexy thing that you can put on a brochure and say, wow, this is a brand new technology that's going to make you live forever. Almost every patient I see that is skeptical about a cortisone injection says, I heard it breaks down tissue. And to a certain extent, they're not wrong. So if I put a cortisone injection in your muscle every day for the next 2 weeks, I would atrophy your muscle. That is a bad idea. If I put it into your joint every week for the next year, I would probably break down some cartilage and things in your knee. That is a bad idea. But when done at a safe interval, which standard of practice is no more often than generally every 3 to 4 months within a joint, there's never been shown to be a negative consequence that has a clinical significance to a patient. So if you have pain and you cannot be active, and I don't give you a cortisone injection, and you spend the next 3 to 4 months not being active, you have taken on more harm than if I gave you a single cortisone injection and you were active for those 4 months. Everything we do in medicine is risk-benefit ratio. And in this case, the risks of the cortisone injection are super low, and the risks of you not moving are super high.
So let's do this. So Dr. Jeremy, I just played pickleball and I injured myself. And you gave me a cortisone shot. And now I'm thinking, should I do physical therapy as well, combined? What are your thoughts about that? Because that's a question that comes up quite often.
I really want to make it clear that you should not be doing an injection or physical therapy before you diagnose a patient. I find that the practice I work at is a top 10 orthopedic practice in the country. So we get a lot of second, third, fourth. I see people who have had a million of consults with people. I get people who travel in from international to come see us because they can't figure out what's wrong. They're not getting better. And almost every time they have not been given a clear diagnosis. There's been so much treatment thrown at them, but then I'll say, well, so what's wrong with you? And they're like, well, I don't know. And sometimes that's because they just didn't understand, but I'll go through the records, and even in the records, you'll say, nobody really ever said what the problem was. So you shouldn't just do a cortisone injection in the knee. Well, if you're somebody listening to this and you're thinking, maybe I need a cortisone injection in my knee, don't ever take a cortisone injection from a doctor who hasn't told you why they're giving you the cortisone injection. You need to know what your problem is first and why the cortisone injection is indicated. Now, to directly answer your question, cortisone injections are an aid. If I gave you a cortisone injection after pickleball and it made your knee pain go down, but I didn't do anything to address why the knee pain came in the first place, you're going to need another injection at some point. So we either need to modify your activity because you're playing too much pickleball and you're overloading it, or we need to modify you. So we need to make you stronger, or we need to improve your endurance or your biomechanics, because otherwise we're just setting you up to come back. I very rarely inject somebody and that is the treatment. Very rarely. I would say if it ever happens, it's somebody who's relatively old. We're talking about probably over 80 years old, severe arthritis in their knee. They're not terribly mobile at baseline, and we're just trying to give them some almost palliative pain relief. And even then, I'm probably still recommending some physical therapy to them.
In the current landscape of where you can access quite a bit, at least some people can access, and this happens where they don't have a diagnosis. They've gone to a clinic or some sort of facility, med spa. There's different names for them. And they have been they received an injection, or they've gone to a facility that has physical therapy, and it might be combined together. And so I love how you focused on getting a diagnosis, because I often say you can't treat if you don't know the diagnosis. What is your path? And that brings into light, there's a lot of things that are out there. I want to focus on cold plunge. Tell me your thoughts on those.
So I'm going to give you a professional answer and then a personal answer. Professionally speaking, I think they're probably a little bit oversold. And I think we've probably seen some of the peak of that marketing. I feel like there's other things that are now being pushed, like red lights and all this other stuff that is taking off more than cold plunging, which had its moment, I feel like, a couple of years ago. There are benefits to cold water immersion, which is probably the correct terminology, at least if you're looking in data. And most of that data says that it probably helps you with recovery better than it helps you with performance. So if you were to do a heavy workout and really exhaust your muscles and get into a cold plunge, there is data to say that you would have a perception of less pain and discomfort the following day. You would feel better the next day. And there's some semantics around this that are probably beyond what we need to discuss, like what temperatures and things like that, because most of these are actually being advertised to be way too cold. It's almost like colder is better, but it's actually not true. There's like a diminishing returns here where you only expose yourself to more risks of the cold and don't get any more benefit from it. But then there's also some conflicting data that says if you do a heavy weight lift and then you get in a cold plunge, it actually prevents you from getting stronger. Like it prevents the protein synthesis that causes bigger muscles. And so it's like, when do you do said cold plunge? And I think ultimately it becomes almost like too confusing to understand when to do cold immersion and when not to do cold immersion. And so this is where I'll transition to my personal answer, because I myself have a cold plunge in my backyard and I enjoy cold immersion. It's something that actually brings me a lot of joy. I don't like to be hot, although I will sit in a sauna, but like I don't actually like sitting in hot tubs. I would prefer a cold tub. I'm not sitting in them for hours. Like I'm sitting in it for like 2 to 3 minutes, but it's very grounding for me. I find myself focusing on my breathing. I'm not thinking much of anything else. I'm doing something that's challenging. And anytime that we do something that's challenging and we achieve it, that's good for our mental. Like there's a lot of data that says that can bring us a lot of health benefits. And I do think the biggest thing that I noticed when I implemented I'm probably doing it 2 to 3 times a week. I have certain times that I do it, like in the morning or the evening. If I do a heavy lift, I do not do it the same day. I try to wait till the next day for that reason I told you. I found that I was less sore overall. Like my back wasn't as tight as it usually was. I would frequently get I'm somebody who subscribes to the once a month massage, and I'm not a sports medicine doctor telling everybody that they should do that. It's just something that has allowed me to make my body feel better. I'm a very tight person. My joints have always been tight. And I found that my massage therapist, who I regularly see, was saying that my body was softer and like less tight after I started cold plunging. So there were some objective findings and subjective findings for me. But the answer for you, if you're listening, is it's not a miracle. Like not everybody should be cold plunging. It's not something that if you're not doing it, you don't need to feel FOMO. If you hate doing it and it's miserable, just like I said, if you're not a runner, don't run. Don't do cold immersion. But if you're somebody who's interested and think, I kind of want to see if it gives me any benefits, try it for a couple months. Keep the temperature between 50 and 60 degrees. Don't stay in for more than like 2 to 3 minutes. Definitely work your way up with a smaller amount of time and see how you feel. The only thing that matters is how you feel. And if you don't feel any different or you feel worse or whatever, like cut it out. It's not doing anything in the background.
I love that prescription to have it be individual. I think a lot of people are like, I have to do this to kind of get this ultimate or optimal health. And what you've shared is, make sure it is serving you, because if you want to do that activity, you're going to run, you're going to do pickleball. It really has to be something that is going to be good for your joints. It's going to be something that you enjoy, because otherwise you are mentally putting yourself through a situation that doesn't make sense. And I love that. So that brings me to supplements, which is another go-to. What are your thoughts on supplements when it comes to recovery and joint health?
How much time do you have?
I know it's a lot. It's a big question.
So there's no miracles in bottles. I would tell you that if you are not accomplishing regular exercise, if you're not getting good sleep, if you're not consuming a well-rounded diet, if you're not avoiding alcohol or maybe moderating alcohol, if you're smoking cigarettes, if you're not drinking enough water, but you're having supplements, you're missing the boat. like supplements are legit. It's in the word. It's a supplement. It's meant to be an addition to. And so I don't really think supplements should play a role for anybody until they kind of have, quote, mastered those other things, which have definitively been shown to be the things that really matter for longevity. Oh, one more, having good support and friends. And so I just find that a little bit it's kind of the lazy way out. And not to say that somebody taking a supplement is lazy. I take a supplement. I take 5 grams of creatine a day. I think that's the only thing I take at this point. And I take that because there's been decent evidence on that for muscular growth, strength. There may be some brain benefits. I'm not too worried about that. and I don't have side effects from it. And creatine's been one of the most well-studied supplements on the face of the planet. And then maybe most importantly, I make sure that I buy creatine from a company that is third-party lab tested. And, this won't date well because you'll release this episode at a different time, but I even just made a post yesterday about making sure that you're getting third-party lab tested supplements, because they just found in a Consumer Reports study where they looked at 15 different protein powders that a decent amount of them had lead in them. And that surprises a lot of people, but this is an unregulated industry. There's nobody regulating them. And so if you don't get a supplement that's third-party lab tested, and we recommend NSF or Informed Sport, but there's a few other ones, you can't even be sure that what's in the bottle or on the label is actually there. And that's the basic level here. So first of all, you have to get one that is third-party lab tested. It's going to cost you more. Don't buy the cheap one. In terms of whether it's going to provide you benefit, let's just stick to musculoskeletal. Glucosamine chondroitin is probably the only other one that has a lot of evidence behind it. It's been studied a ton. It's been shown to help people who have arthritis with their pain as much as ibuprofen. So is it growing cartilage? It's not. You can't start taking glucosamine chondroitin today. I don't take glucosamine chondroitin, and I'm not taking it because I know it's not causing any cartilage regeneration in my knee. So if I start to have pain in my knee, I could consider taking that in lieu of a medication, knowing that it's probably a little bit safer than especially like the NSAIDs, but I'm not too worried about that. So it was a long-winded answer, Bayo, for me to basically say, I don't think there's any magic in supplements right now. And most of the time it's completely marketing over science. And if you're listening to this podcast and you're worried about what supplements to take, I would make sure you're doing those other behaviors really well. And then at that point, the two that I think have some value to them are probably creatine and glucosamine chondroitin.
It's unregulated, and people want to feel better, and you see ads, you see all kinds of things that are marketed to make you feel better if you take this pill. But what you're taking, you have no idea what's in it unless you go through those third party. And I'm glad that you highlighted that, because I've personally seen patients come in with liver failure because they took something over the counter and ultimately actually caused a toxicity to their liver. Just glad that we're highlighting this.
If I can say one more thing about supplements, just that would help people, and I think it's accessible. There's a website called examine.com. Examine.com is very well run. They don't take ad money from anybody. It is a bunch of people who came together who wanted to make, supplement science information available to everybody. And so they have a free version and then a subscribed version. They're funded strictly by subscriptions. The subscribed version gets you a lot more information, but if you go in there and type creatine, you'll be able to see in very well presented information, like what the evidence is behind it, ABC, kind of what things have been shown to be beneficial, what has not. And then in addition to that, dosing and things like that. So for anybody listening who's like, I need a good reference, I would highly recommend examine.com.
Oh, that's a great resource. And do you mind repeating your third party, the two companies that you mentioned?
Yeah. So NSF is the one that's referenced the most, and that's because they are the only ones that like professional athletes and Olympics will use. Informed Sport is also very good.
Fantastic. We are in respiratory season, and there's this kind of, when I'm sick, I shouldn't work out. It could actually increase my risk for injury. What are your thoughts on that?
I would say the vast majority of the time, it's the opposite. Kind of like we said, don't exercise because you're going to destroy your joints. Not exercising while you're sick is not helping your illness go away. We want to keep our body healthy, and exercise helps. So there's a couple things that you can keep in mind to stay safe. The first is you should never exercise with a fever. And generally speaking, what we'll say is don't exercise within 24 hours of a fever. Defining a fever as 100.4 or above. And then if you're taking medication to keep a fever down and you don't particularly know if you had a fever because you're on medicine, you probably should be off of medication for 24 hours to know you haven't had a fever. And the reason for that is that there's an increased risk of myocarditis, so inflammation of the heart, if you have a fever and you exercise. So that is one absolute no-no, and that we do that for the professional athletes too. If they have a fever, they're not exercising for 24 hours. The other thing probably to keep in mind is that you'll, depending on what type of illness you have, like you potentially could get more dehydrated. You may not have the stamina. You may not be consuming as much food or or liquid, you may be off of your usual. And so you may want to consider tempering the intensity and the duration just to kind of make sure that you're not overstraining yourself. But I certainly think it's good to move while you're sick.
Those are great lessons. I was actually going to ask you, what lessons do you carry over from your work with professional athletes that you would share with the listeners right now?
I love to say that professional athletes are no different than us in many ways. They have two things that primarily make them different than you and me. One is they're very, very good at something that you and I are not as good at. And generally speaking, they also tend to have a body type that is not the average body type. And then the second thing is they tend to be making a decent living off of doing said thing. And so their goals are different, right? So their prime earning years are before the age of 35 to a certain extent. And so when they get evaluated and treated and make recommendations and go down different pathways, you have to always remember that we always give them short and long term when we're making recommendations, but they're going to balance the short term a little bit more than the average person because their peak earning years are basically 10 years. And they need to make those decisions to make sure that they're maximizing those times. We don't sacrifice the medical care that we're doing. We would never put somebody at harm 20 years from now by doing treatment now without at least having the conversation about that pros and cons. There's lots of information with that. So when I see patients in the office and they say, well, I'm not a professional athlete, I usually tell them back, you may be exercising more than my professional athlete because my professional athlete, they're almost easier than, especially my youth athletes are harder than my professional athletes because they don't have an off switch. Like my professional athletes know that the most important thing is that they stay healthy, stay on the floor or in the field or on the court or whatever, so that they can get their next contract and perform. They love to recover. They love to take the time off that they need to. When the season's over, they go on vacation. My high school baseball players done, or even 12-year-old baseball players done, they play more baseball. They don't stop, but they also don't train to do it. So my advice that I give to professional athletes, or my advice to you, is to treat yourself like an athlete. You're an athlete. If you're exercising 5 to 7 days a week, you're an athlete. You're just not 6'7" and dunking a basketball and making money to do it. So yes, you're not doing the same thing, but you have to treat yourself like an athlete. Otherwise you're going to break down. Think about yourself like an athlete.
Those are great affirmations. I'm like, okay, I'm an athlete. I'm an athlete. Like that's wonderful to kind of get you kind of in the mood. And also it's very powerful. It's amazing how those words can make you all of a sudden, I feel perked up in my seat right now. I'm like, I'm an athlete.
Well, you've inspired me. Let me tell you one other example. You've inspired me. So golfing, I love to golf. And I will tell you, nobody warms up to golf. I don't know if you golf, if you know anyone who does, but if you go to a recreational golfer, an amateur golfer, so not somebody on professional tour, and you go to the golf course and you watch them before a round, the vast majority of them, if there is a driving range, will just go and start whacking some balls and talk to their friends. Hit a ball, talk for a few minutes. Hit a ball, talk for a few minutes. Go to the putting green, do some putting, get on the course. And I'm the weird guy in the back that's kind of doing some walking lunges and twists and turns and hamstring stuff. It looks weird that I'm doing it. But I will say to my patients who are golfers, I'm like, you do know that the professional guys show up 2 to 3 hours before their tee time and are exercising and getting ready. And they're like, well, I'm not a professional golfer. I'm like, do you play 18 holes? And they're like, yes. And I was like, how many days a week do you play? And these guys are like, I don't know, 3 or 4. And I was like, how many do the professional golfers play? They play 3 or you are doing the same thing, and your body is not as, yes, you are not getting paid. You are not as fit. You are not as young. That's probably more reason to be doing it. You need to be warming up. You need to be doing these things to take care of your body. You cannot just show up and play and expect to be able to keep doing it the rest of your life. You have to take care of yourself.
Right. Every activity you need to, I grew up dancing, so ballet, jazz, and hip hop, but it's important. One thing that happened to me at my daughter's dance class, they have where a parent can join their child, and they do this once a year. And often I'm rushing, getting off work, trying to get there in time. And then I do the full dance class, and rightfully so, I can't move. I'm right at the end. And then the next day is quite painful. But if I was to even warm up, even though it's been a couple of months since I've danced, it makes a difference. So I love that you mentioned that. This brings me to, with so much conflicting information about wellness influencers, what do you wish people knew about aging, movement, and longevity?
That there's no magic secret, that everything that's being pushed on social media that seems new and exciting and easy generally is making somebody else a dollar and using you as the experiment. Vast majority of the time, they don't have evidence behind them. If they do, it's usually on animals. It's an opportunity for them to capitalize on us feeling more mortal and morbid. Every time we get older, every birthday we have, we think we're closer to death. And if somebody markets us something that says that we would live longer or be better, we're willing to listen. And I've experienced this myself. I'm not immune to this, and I do this for a living. Unfortunately, it's not complicated, and it doesn't spread over social as easily. Like, you don't get a lot of likes by saying you need to sleep 7 to 9 hours a day, you need to be exercising 5 to 7 days a week, you need to be weightlifting twice a week, you need to have a well-rounded diet. It doesn't really matter what you're eating, it just needs to be well-rounded and probably not consuming more calories than you need. You need to make sure you're hydrated, you need to have good friends and community support, don't smoke, and make sure that you're moderating your alcohol. It's 8 things. It's more complicated than you think it is. It's very challenging, but that's the secret. That's it right there. And none of it's monetized. That, like, you don't need money for any of that. If you're ever considering something that is in the wellness world that is either advertising to you that it can make you stronger, faster, live longer, always view it with an air of skepticism. Think to yourself, why do they want to sell this to me? And what do they get out of it versus what do I get out of it? And I think it'll at least create a little bit of like that pause so you don't hit the buy now thing right away. And I find that most of the time you sleep on it, you wake up and you're like, I don't even know why I thought I was going to buy that.
That's powerful advice. Like, what is the incentive? What is behind that ask? So to wrap up our conversation, if you could give listeners 3 takeaways about staying active and preventing injury, what would they be?
Get started today. There's no reason to wait. If you're somebody who has not been exercising, it's okay. Start now. It has compounding returns, so you can catch up quickly, but don't get too excited and do too much too soon. You don't have to be exercising a ton immediately. Gradually increase it so you avoid injury. Lift weights. I don't think we spend a lot of time on this, but we know that we lose about 8 to 10% of our muscle mass every decade once we hit about 35. So you are naturally going to lose muscle and there's nothing you can do about it. But if you think about muscle like a jar of water, and when you hit 35 to 40, the bottom of that jar gets a little spigot that starts dripping out, and weightlifting is filling it up from the top. The more full we can keep it to begin with. So anybody in their 20s to 30s listening to this, start lifting weights now. And if you're 45 and you haven't lifted a weight a day in your life, start dripping water in the top so that as it comes out the bottom, you're putting some back in the top. That was 2 things. What's the third thing? Injury prevention. The vast majority of injuries happen because of fatigue. So don't think of recovery like being those compression boots or cold plunges or supplements or like the percussion guns. Think of recovery as charging your cell phone. Think of it as like charging your battery so that your muscles are ready to go for the next time.
Fantastic. Dr. Jeremy, this has been such a great conversation. I really appreciate how you break down these complex topics about movement and injury prevention. I know everyone will feel more confident about staying active safely and making informed decisions about their bodies. For those who want to learn more about Dr. Jeremy, you can find him all over social media. We'll have all the links in our show notes. Dr. Jeremy, any final thoughts?
No, I really like talking to you, Dr. Bayo. I can see why patients come to see you.
Oh, thank you. I love talking to you. Did something in this episode change the way you think about movement and injury? Share it with someone who might be struggling and staying active or recovering from an injury. Because here's the truth. Your body is designed to move, and understanding how to do it safely isn't just about preventing injury. It's about building confidence, maintaining independence, and living the active life you want for years to come. You've got this. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.